Hi guys, first of all by thanking patient and patient attenders for giving the permission to doing this video. So this is a case of very serious condition like scorpion sting patient. So he is the age of 7-year male boy. He came to hospital with complaining of severe pain and giddiness since 3 hours. So he was having history of scorpion bite. That is 3 hours back. So what you have to know in this patient is, so any scorpion bite for any treatment purpose or for a clinician purpose, so we have to divide the scorpion bite into 5 stages. So before that, what you have to consider is whether the which scorpion bite to be admitted and which scorpion bite should not be admitted. So any patient, in first patient, if any patient come to hospital with history of scorpion bite, we have to observe the signs what they have developed first. If it is only like I will tell the signs in next stage. First we have to grossly divide is any change in the vitals. First you have to see. And one more thing is whether the patient is having a history of the same and the patient is had a scorpion bite and he is not at all having any signs. This in this patient we have to put still even after they are not having sense, then also have to put the patient in observation. So we have to observe. Patient may develop the scorpion signs like after 24 hours to 36 hours. In this time, patient may develop at any time. So what you have to do is, in first you have to assess the conditions. So in first stage, like we have divided classic 5 types. So in 5 stages. In first stage, you have to observe whether the sweating, secretions, and any priapism and mydriasis, these are, and cold extremities. These are the first stage in the scorpion bite. In next stage, in second stage, they will develop hypertension. And actually, first stage is when you patient got any scorpion bite, that till 3 to 4 hours it is the first stage. After 4 to 6 hours, it is the second stage. So in 4 to 6 hours, that is second stage, patient may have tachycardia, patient may have hypertension, patient may have cold extremities. These are the second stage, that is 4 to 6 hours. After 6 hours, that is 6 to 10 hours, the patient may have the symptom like it has mildly he may go into the shock. That is hypotension, tachycardia, cold extremities, mild pulmonary edema features. So this is the third stage of scorpion bite. What are the fourth stage of scorpion bite includes hypotension, tachycardia, and the pulmonary edema features, massive pulmonary edema he may develop, and the varying like patient may have giddiness and severely cold extremities. This is the fourth stage. After that is fifth stage, that is more than 10 hours, that is more than 12 hours, it is the fifth stage. In fifth stage, patient will have severe hypotension, severe tachycardia in this patient, and they will be having massive pulmonary edema. In this patient, they will be high risk patient. So what you have to do is, you have to observe this patient now. You just come here. So he is a 14-year male patient. You can see the sweating here. You can see the salivation also. You can see the secretions coming from the mouth, sweating. See, this is sweating, secretions. This is a moist tongue. You can see the mydriasis in this eye. Mildly they will be dilated pupils. So this is, he is developing mydriasis, and secretions you are seeing here. This is a secretion, sweating, and you can see the sweating here. With all this, and we can look for the priapism also. That is erected penis. You can see this. This is a priapism. So this is a signs of, you can see hardening of the penile tissues. See, erected hardening of the penile. This is called priapism. And secretions, priapism, and he is having cold extremities. So this is the first stage. He is having all these signs. So this is the first stage. That is, he is having history of scorpion bite 3 hours back. So in this first stage, he is having secretion, sweating, priapism, cold extremities, everything. So what you have to do in the first stage is, we have to do the treatment part I will discuss later. And the second stage, if they not given any antidote, like priapism, prazosin, there is an antidote for this scorpion bite. If it is not given and not treated symptomatic, not treated immediately, they may develop in the next stage. So next stage it includes hypotension, tachycardia. Now BP, everything is normal. So BP pulse, everything is normal. So he is not end up in the second stage. If it is the second stage, he may have hypertension, he may have tachycardia, he may have any mild breathlessness. And third stage, he may have some pulmonary edema features. So this is a clinical presentation, that is symptomatic and the signs. So what you have to do, we have to discuss about the treatment part now. So for this treatment, in the first stage, you can see all these things: secretions, priapism, midriaism, and the secretion. All these things, what you have to do is we have to give the antidote. So antidote is prazosin is the antidote. So what are the dose of the prazosin is very important. Dose of the prazosin is only 30 microgram per kg per dose is the dose of the this prazosin. So in this patient we have to give, depending on the hypertension, actually it should be given every 4th hourly, every 6th hourly. If the patient is having so symptomatically, we have given now one prazosin given, that is a dose of 30 microgram per kg per dose we have given, and next dose to be given accordingly. So this is a very condition. Only thing what I am discussing here, scorpion bite, it looks it takes someone think that it's a easy job. No, it's not easy. If the patient develops serious signs and symptoms, patient may have end up in the serious condition. That's why any scorpion bite, any other bites, to be treated very seriously, and think that it may be it may develop in the pulmonary edema, anything. So if it is developed pulmonary edema, we have to give Lasix injections, anything. If it is developed hypotension, dopamine to be given. So prazosin is the main drug. So there are some how the anti-snake venom in the same way anti-scorpion venom will be available. So this to be given accordingly. Thank you so much.